my name is Brittany. I'm going to be your nurse today. Can you tell me your fake HIPAA name?
Katrina June Smith,
What is your date of birth?
6/5/1989,
And what year is it?
2019.
And who is your president?
Donald Trump.
And why are you here?
For an assessment.
Okay. As she's talking, I'm making sure she's alert on sport and that she knows why she's here. And whenever she walked in and I put her in a gown, I made sure that she knew that she had good appearance, that she wasn't disheveled, and that she was well kept. And then when doing that, we got her height and her weight. Her height is 5 foot. Her weight is 143. We looked on the BMI chart and it's 27.9. After we did that, we went to the Snellen test. We stood 20 feet away from the Snellen test. She closed both one eye at a time, and both eyes registered at 20/20, which means she can see from 20 feet away and 20 normal people. And then what I'm going to do is get her vitals. Her temperature was 98.2. Her oxygen is 98. Her heart rate was 72. And our blood pressure was 100/62. So what I'm going to do now is I'm going to start from head to toe. I'm going to look at her head. Her head is normal cephalic. I'm going to take my fingers and I'm going to palpate her scalp and her skull to make sure that I don't feel any abnormalities such as lesions or any indentations or protrusions or infestations. And everything looks good. I don't see anything abnormal. And then after I do that, I'm going to look at her face. Her face is symmetrical. I'm going to look at her eyebrows. They're even. Her mouth is even. Her ears are even. Her nose, the nasal labia fold is in the center. And then I'm going to ask her to smile. Ask her to frown. Now close your eyes really tight. Good. That is checking her cranial nerve number 7, which she did really good. And then I'm going to check her sinuses real fast. I'm going to push on her frontal sinuses. Does that hurt?
No.
A little pressure? And then I'm going to push on her maxillary sinuses. Did that hurt?
No.
Okay. And then I'm going to feel her skin. Make sure I don't feel anything. Nothing there. After I do that, I'm going to tell her to open her jaw. Close. Good. There's no crepitus there. Then I'm going to look in her eyes. Her eyes are good. They follow direction. I'm going to check to make sure her eyes dilate and constrict. Good. Good. Her eyes are reactive and normal. So then we're going to do the cardinal 6, and this is going to check her 2, 4, and 6 cranial nerve. Just follow the light and don't move your head. Good. Good. After I get done with her eyes, I'm going to tell her to look up. I'm going to look at her sclera. It's white. Her conjunctiva is pink and moist. And then I'm going to palpate her ears. Make sure that I don't feel anything. Her penis good. There's no extra serum coming out. I'm going to whisper to check her gross hearing.
I'm ready to go to Florida. I'm so glad to be here.
Okay, she did good there. So then I'm going to, her nose is midline, palpate it. I don't feel any lesions, nothing. I'm going to ask her to breathe in. Good. Good. They're both patent. The septum is midline. And then I'm going to look at her mouth. Her lips are pink and moist. And go ahead and open. I'm going to look at her teeth. Are you having any problems swallowing, chewing?
Mm-mm.
Teeth hurt?
No.
Okay, I'm gonna tell her to lift her tongue, and I'm gonna look for cancer spots, any lesions or abnormalities, and I don't see any. And then I'm gonna tell her to say ah. At this time, I'm looking at her uvula, and it's good. And then I'm gonna tell her to she's already sticking her tongue out. So we just check the cranial 9, 10, and 12. Then I'm gonna inspect her neck for any type of lumps or enlargements or anything like that. There's nothing there. And then I'm going to palpate. And as I palpate, I'm going to do it in circular motions. Any tenderness?
No.
Any problems swallowing or throat hurt?
No.
Okay. And then I'm going to palpate her carotid. Good. Good. It's class 2, regular rhythm bounding. I'm going to listen for a bruit. I'm going to use the bell when I listen. Good. No bruits. Now I'm going to check your arms. Normal skin, no excessive bruising, no lesions, no moles. I'm going to check to make sure that she has good strength in her arms. Go ahead and hold that for 5 seconds. No, that one. Good. Can you squeeze, push, and then pull? Her strength is equal on both sides, bilateral. And then I'm going to check her capillary refill. It's less than 2 seconds and brisk. And then I'm going to look at her profile. There's no clubbing. Same with this hand. 2 seconds, brisk. No clubbing on this hand as well. And then after we get done with that, I'm going to look at her breathing. She doesn't use any accessory muscles. Everything's normal. Her breathing's normal. It's symmetrical. And then as I'm doing that, looking at that, I'll go around and check her back, and I'm looking for any kind of lesions or any abnormalities. There's a couple freckles that I see back here, but nothing to be suspicious. And then when I do that, I'm going to go ahead and listen to her lungs. Deep breath. And then normally I would listen for 3 breath sounds and each. And I'm going to go to the back and listen. Just take deep breaths again. And again, I would listen to 3 breaths at each spot. The breath sounds are good. They're a little diminished in the bases. Everything else is clear. Whenever we listened to breath sounds, she didn't have any wheezing or no rales or bronchi. Everything was good. On most patients, this would be the time that I would do the breast exam. She's opted out on the breast exam, but if I was going to do it, I would have her to lean forward and look for some indentations or any kind of protrusions or any kind of leakage. And then I'd have her hold her arms out and do the same. And then when I go to do the palpate her breast and the lymph nodes, I want to palpate deep the subclavian, the central, and then the bronchial, the external mammary, in the pectoral. So when I do this, I'm looking for any kind of hard lymph nodes that are hardening or feel abnormal. I do it to both sides, the same. Deep palpation. And then if I was going to do the breast, I would start at the telostance. And when I start at the telostance, I would take the pad of my fingers and I would do it in circle motions until make sure that I don't feel any abnormalities or indentation, or make sure there's no leakage at the nipple. So after I do all the breast exam, I would then do the heart, and I'm going to auscultate her heart. I'm going to start at the apical. When starting at the apical pulse, this is where I would usually listen, and I would time how many her heart rate, which we've already gotten, and then I would listen to the pulmonic, the tricuspid, and the mitral. And then I would use my belt, and I would also, again, listen to the tricuspid and the mitral. When doing that on her, I only hear the S1 and S2. There's no extra heartbeats. There's no murmurs. There's nothing that is abnormal. Then I would ask her to lay down. And then on the abdomen, it's a little bit different. At first, I'm going to inspect. When inspecting her belly, I'm just going to make sure there's no ascites, that there's no hernias, that I don't see any abnormalities. Have you had any surgeries?
No.
Is there any pain?
No.
Any discomfort at all?
No.
Okay, so after I do that, I'm going to listen to her belly. I'm going to start in the right lower quadrant and listen to her bowel sounds. I'm going to listen for at least 15 seconds until I hear them, and she has great bowel sounds. I'm going to work clockwise again to all 4 quadrants. Good. And then I'm going to take my belt and I'm going to listen to the aortic and then the renal arteries. And I used the belt to see if I heard any bruise, and I didn't. Everything's good. And then since she's laying down, I'm going to go ahead and percuss. And when I percuss, this is just barely tapping again, okay? Okay. Can you breathe in? Take a deep breath. I'm going to deep palpate there. Good. Any pain?
No.
No pain or tenderness anywhere.
No, nowhere.
Okay. So I'm going to make sure that I don't see any lesions or anything. Everything sounded good. Nothing was abnormal. Then I'm going to go ahead and tell her she can pull her shirt down. And then we're going to inspect her legs. And when I inspect her legs, I'm just going to look for any lesions, discoloration, hair distribution. And I'm going to also feel her pedal pulses. Good. They're +2, regular. Good. And again, I'm going to check her capillary refills. Less than 2 seconds. I'm brisk. Good. I'm going to check her strength. Can you lift that for 5 seconds? Good. This one? Good. And then I want you to push. Good. Pull. Strength is equal, bilateral. Okay. Can you set up for me? Now I'm going to check your century. So again, close your eyes. Sharp, dull. Okay? You know that? Do you feel the difference?
Yes.
Okay. Go ahead and close your eyes again.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. sharp, sharp,
Good. And then I usually would check your reflexes, but I don't really have anything. Good. And then if I was down there, I would check the Babinski sign, which is I would take a scapula of your foot and your toes should curl, or you pull back from me. Either or. So can you stand? Well, we'll do this. Nose. Good. Coordination's good. Then we'll have her stand up. Close your eyes. And this is the Romberg test. Go ahead. Balance is good. Everything's symmetrical. Go ahead and sit down. And that is a head to toe assessment.
Thank you.